This video is for information for people who want to know what is physiotherapy and what all are the services a physiotherapist can offer to the humankind to resolve the ailments what people suffer with. In the due course, if I make any statements which feels otherwise, kindly understand the meaning of what is being said and there is no offense against anyone in this. Physiotherapy, also known as physical therapy, by the word self explains, it is a physical form of treatment. In this, physiotherapists do treatment physically and do not prescribe medicines or do not give injections and do not do any surgical procedures. It is only physical form of treatment, either using their hands or using any equipments or any assistive devices. Having said, physiotherapy is involved in various medical fraternities. Let me explain how physiotherapists play a significant role in different areas of medicine. The first one is pain relief. Either it be muscular, bone and joint related, ligament, nerve and disc related, physiotherapists can do a proper evaluation and recommend physical treatment which can solve the issue. I'm not denying medical support. What I say is the physical treatment can be offered by physiotherapist and the medical support can be given by the physician. Physiotherapists who are specialized in treating neurological conditions can rehabilitate patients who have got affected with stroke, brain injuries, after road traffic accidents when the person becomes medically stable, and movement disorders like Parkinson's disease. Physiotherapists who are specialized in pediatric care have the expertise in treating almost every birth related disorder. One example is cerebral palsy, and the other example is delayed milestone developments, and various other brain and spinal cord related disorders in newborn. Physiotherapists play a significant role in community rehabilitation, helping elder people to prevent balance issues, fear of falling, and to help them walk and do exercises which are required for maintaining their quality of life. If anyone has undergone any form of heart surgery or any complicated treatment for the lungs, the role of cardiopulmonary physiotherapist becomes more significant in rehabilitating the person through exercise prescriptions where they decide what is the level of exercise a person can perform, till what intensity they can push themselves so that they can be safe. And these physiotherapists are specialists in designing exercises for various populations like healthy individuals, special population, pregnant women, and people who have got lifestyle disorders also. Sports physiotherapy is another popular specialization in physiotherapy which is not limited only to on-field sports injuries treatment. Sports physiotherapists have the responsibility of specifically identifying the cause of the injury, treating and rehabilitating, and getting the athlete or the sportsman back to sport with highest level of performance. Sports physiotherapists integrate holistic approach in their treatment methods for providing faster relief. Like cardiopulmonary physiotherapists, sports physiotherapists are also qualified to identify, evaluate, and design exercises for general public, for amateur to elite sportsmen, for pregnant women, for people with lifestyle disorders like diabetes, PCOS, and also for special population. The commonly known specialization in physiotherapy is musculoskeletal or orthopedic. These specialists are experts in treating post surgical conditions like after any bone or joint operations. These physiotherapists have in depth knowledge about mechanically induced pain and treating repeated stress injuries. Physiotherapists are also involved in treating women health issues. These specialists train women before pregnancy, during pregnancy, and after pregnancy. These specialists also treat multiple women health related issues. The most commonly known are pelvic floor dysfunction, PCOS, and urinary incontinence. The other area of physiotherapy is yet to get familiar is men's health. The common issues what men face are pelvic floor dysfunction, has multiple extensions to that, and urinary incontinence. Physiotherapists are involved in treating work related musculoskeletal disorders and repeated stress injuries. These are commonly seen in industries and companies where people use desktop, laptop, and keyboard, and in various environments where they keep changing their sitting positions. And this is known as ergonomics. And this doesn't limit only to workplace. This is also applicable to kitchen, backpack usage, two-wheeler or four-wheeler usage, and in various other working professions. Physiotherapists can work with ophthalmologists in treating ocular muscles for squint correction. Physiotherapists can work with dentists to treat temporomandibular joint dysfunctions. Physiotherapists also can work with otolaryngologists in treating body balance issues using vestibular rehabilitation methods. Physiotherapists who are specialized in treating hand conditions, which we call as hand rehabilitation, work closely with occupational therapists and hand surgeons to produce results for conditions related to the hand. The upcoming specialization in physiotherapy is oncological rehabilitation, where physiotherapists treat cancer patients in conditions like lymphedema and cancer pain. Few physiotherapists are specialized in exercise and sports science. These specialists work closely with cardiopulmonary physiotherapists, sports physiotherapists, and physicians treating lifestyle disorders like diabetes and PCOS. These specialists evaluate and design exercises depending upon the energy expenditure of these lifestyle disorders involved people. Therapists take responsibility of improving the quality of life by helping them to perform exercises at their tolerable levels and improving their quality of life by reversing diabetes as well as PCOS. Having mentioned so many specializations and the role of physiotherapists being significant in all these areas, it is so evident that physiotherapists have to undergo an intense training process and a learning process for producing results in different fraternities of medicine, which means physiotherapy is a skillful profession where physiotherapists produce results in multiple areas, which is beyond IFT and ultrasound.